Hi guys, my name is Rachel Weldon, and today we're going to be going through pacemakers and ICDs. So to begin, we're going to look at some statistics about heart disease in the United States. So in the United States, currently 27.6 million adults are diagnosed with heart disease. 610,000 people die of heart disease every year, and if you break that down even further, it means that 1 in 4 deaths is actually from heart disease. Heart disease is the leading cause of death for both men and women. Out of the 27.6 million adults, 2.3 million have a permanent pacemaker, and the American Heart Association estimates that each month 10,000 Americans receive an implantable cardioverter defibrillator, which is an ICD. So next we're going to look at a map of the heart disease and death rates in the United States. So in the years 2011 through 2013, it's pretty evident that heart disease is more on the south side of the United States than compared to the West. So the dark red and dark pinks are the higher number of deaths in the United States due to heart disease. So now we're going to look at what exactly a pacemaker and an ICD are. So we'll start off by talking about implantable cardioverter defibrillators, which I'm going to refer to as ICDs through this presentation. So what is it? An ICD is a battery-powered device that is surgically placed under the skin. The ICD keeps track of the patient's heart rate. It's used by very thin wires that connect the ICD to the individual's heart. If an abnormal heartbeat is detected, the ICD will sense an electric shock to restore a normal heartbeat. And current ICDs also have a dual function where it can also be used as a pacemaker. So the image to our right here is going to show you how the ICD is implanted and attached to your heart. So you can tell it goes through the right atrium to the right ventricle, and this picture just shows this is actually the shock happening and how it stimulates. So next we're going to look at pacemakers. So what is a pacemaker? A pacemaker is also a surgically implanted device that helps a person's heart beat more regularly. The pacemaker is placed under the skin on your chest, directly under the collarbone. And the pacemaker also sends a small electrical current through thin wires to help control the patient's heartbeat. So a picture up on our right again shows you the pacemaker. It's a little bit smaller than the ICD, but it still runs through the right atrium into the right ventricle. So when researching these, they seem a lot alike to me. I'm sure they seem a lot alike to you. So we're going to compare the pacemakers and ICDs. So again, what is the pacemaker? It helps control abnormal heartbeats. It transmits electrical pulses to help the heartbeat at a normal rate. It helps to treat irregular heartbeats, ones that are too fast or too slow. The pacemaker can relieve some symptoms related to arrhythmias, such as fatigue or fainting. And it helps patients resume a more active lifestyle. So what is the ICD? It is also used for irregular heartbeats, but it's also used as well for people at sudden risk for cardiac arrest. It sends electrical pulses to the heart when abnormalities are sensed. The ICD actually continually monitors your heartbeat and sends low or high energy electric shocks to correct the abnormal heartbeat so it can sense what kind of shock it needs. More effective in patients at a higher risk with a history of sudden cardiac arrest who need high pulse electric shocks to restore a person's heartbeat. So who needs a pacemaker or an ICD? Individuals who obviously have arrhythmias, which are irregular heartbeats, which we just learned in the slide before, are heartbeats that can be too fast, too slow. ICDs are most commonly used in patients who have had previous episodes of ventricular fibrillation, and ventricular fibrillation is a severe twitching of the heart which leads to cardiac arrest. So who is most likely at risk for needing a pacemaker and ICD? Well, arrhythmias are most common in older adults. Most serious arrhythmias occur in people older than 60. When we're looking at ethnicity, 23.8%, which is the highest percent of deaths, occur in non-Hispanic whites and non-Hispanic blacks. There's many possible causes of arrhythmias, including heart attack, scarring of the heart tissue, blocked arteries, hypertension, smoking, excessive caffeine or alcohol intake, drug usage, stress, certain medications, sleep apnea, and genetics. So are genetics involved in arrhythmias, as we learned in the slide before? Yes. Some heart rhythm disorders can be inherited. The majority of genetic mutations responsible for causing hereditary arrhythmias are passed through a family in an autosomal dominant pattern. This just means that the mutated gene is a dominant gene that's located in one of the non-sex chromosomes. Some of the more dangerous heart rhythms that can be genetic include long QT syndrome, the Borgata syndrome, short QT syndrome, and there's many more listed below, which I would try and pronounce, but I guarantee I will butcher them. But you can read these on your own if you're interested. So symptoms to look for if you have a patient or a client who has heart arrhythmias. Just know that they're fairly common, even more so as we grow older. Most are harmless, but some can be dangerous. So what should people look for? You should feel that single premature beats are felt as palpitations in the heart. And a rapid succession of premature beats are often told to be felt as like a fluttering sensation. There's also more serious symptoms that can develop, such as fatigue, dizziness, lightheadedness, fainting, shortness of breath, chest pains, and sudden cardiac arrest. So in addition to the pacemaker and ICD, you should know that ICDs and pacemakers do not change the underlying condition that leads to their surgical implantation. You should follow your doctor's instructions for treating your underlying condition. There are many medications that can go along with your implanted device. Medications work with your ICD or your pacemaker to help your heart pump more regularly. Medications can help prevent heart attack and stroke, and you should note that you should always keep a record of what medications that you take. So some possible medications listed here are antiarrhythmic drugs, which treat premature beats, calcium channel blockers, interrupt the movement of calcium into the heart and blood vessel tissue, which lowers your heart rate. There's beta blockers, which decrease heart rate and cardiac output and lowers blood pressure. And there's also anticoagulants, which are blood thinners and make it hard for your blood to clot. So now that I've given you all this information, what should we look for? What should we be considering? Well, we should always monitor your heart rate, take your pulse, especially if you have a pacemaker or ICD. So how would you do that? I use a Fitbit and I think it works pretty accurately. I recommend that for anyone who exercises. So you can use a device that can keep track of your heart rate, such as the Fitbit just mentioned, running watches or fitness trackers. You can also take your pulse manually. That's just important to know. If you don't know how to take your pulse manually, there's a nice picture depicted right here. So you put the second and third fingers of one hand on the inside of the wrist of the other hand, just below the thumb, or there's also an artery right on your neck, which if you push pretty hard, not too hard to cause pain, but you can feel pretty evidently, just below the corner of your jaw. So you feel for your pulse and you count the number of beats per minute. So what about exercise if you have arrhythmias and if you have a pacemaker or if you have an ICD? So we should know not to be nervous about exercising. Give surgery appropriate healing time. So this is usually 12 weeks to do any type of serious activity. Although after surgeries, you do want to try and get up and move as quickly as possible. It's going to be easier for your body. Make sure your energy levels are normalized. And just know that exercise is safe and important for heart health. Key things to remember if you're exercising with a pacemaker or an ICD. To carry your medical ID at all times. Always wear a heart rate monitor. Ease into an exercise routine. And it's critical that you want to avoid contact sports of any kind. Taking hits can dislodge your pacemaker or ICD and could possibly shift wires in your heart. So that would cause serious problems. So this is actually exercise responses to any different types of heart diseases. So it has a positive effect on different areas. It increases your VO2 max. It increases your central hemodynamic function, which is blood flow throughout your body. It helps your autonomic nervous system function, your peripheral vascular and muscle function. It helps to increase your exercise capacity. It actually reduces stress hormones as well, which can put extra burden on your heart. It increases the high-density lipoproteins and help manage blood sugar and insulin levels, and it can reduce your risk of heart attacks. So all these are pretty important with anyone who suffers from a heart disease and if you have an ICD or a pacemaker already implanted. So this is a case study that I found looking at ICD in comparison to exercise. So exercise can keep ICD and pacemaker patients fit without raising shock risk. Moderate aerobic exercise can improve your cardiovascular health. So I researched that a study published in the Circulation in 2015 tested 160 adults with an ICD for primary or secondary prevention of cardiac arrest. So you can see that these individuals all had some type of cardio arrest episode or had family members that had cardio arrest episodes. So the outcome of this case study showed that the patients who underwent an aerobic training program for 6 months had much higher peak oxygen consumption, which is your VO2 max levels, compared with those who received no exercise prescriptions. So it's pretty evident here that their VO2 max did increase, and I'm sure there's many other ways to increase as well, but this study just focused on their VO2 max. So the case study that I created, we have Mr. Schofield, who is a 67-year-old Caucasian male. He is 12-week post-implantation of a single-chamber pacemaker due to SA node dysfunction, as well as symptomatic bradycardia. His major complaints before the insertion of his pacemaker were fatigue, dizziness, and having trouble doing his morning walks with his friends from the senior living community. So you can see that he didn't have cardiac arrest, and so they used a pacemaker for his dysfunctions instead of the ICDs. So now we're going to take a look at his risk factors. So his age is 67, so that's a risk factor. He was a cigarette smoker but quit at the age of 30. He had moderate exercise activity, so he walks 3 to 4 days a week, which was stated he likes to walk with the people from his senior living community. He is overweight because his BMI is 26.96, which is just slightly overweight, but something we should consider. His blood pressure is 132/84. His total cholesterol is 202. Low density lipoprotein is 102. His HDLs are at 39, which you typically want them 40 and above. And his fasting glucose is 112, which is close to pre-diabetic, but not yet pre-diabetic. But it's just something to take a look at. So we would classify him as high risk. I apologize, that was supposed to be a little more evident, but my face kind of covers it. And we did that because he already had heart disease issues, and his age, his BMI, and his HDLs do have an effect. So for Mr. Schofield, we would do exercise testing because of his age and the fact that he already has a pacemaker implanted. 2 types of tests we could do are the 6-minute nonstop walk test, and that's useful for assessing risks and benefits of exercise training. Another test that's typically used for people that are a little bit older are chronotropic assessment protocol workloads. And this does workloads that gradually increase, and they're supposed to mimic different ranges of daily activities that they would normally perform. And on your right here, I have an example of what a chronotropic assessment exercise protocol would be. So what would his exercise prescription be? Note that avoid contact sports and include resistance training to build muscle mass. So we would continue with aerobic. We would do 5 days per week for Mr. Schofield. And on a scale of 1 to 10, we would want a 4 to 6 rating for moderate intensity. Time is 20 to 40 minutes. And what type? We would do walking, swimming, things that are not rough on the joints. And on the scale of 1 to 10, we're going to use the RPE scale right here that I depicted for you. And also because he does have heart issues, you'd also want to have an angina scale and keep it between 1 and 2 when doing any type of activity. For his resistance training, we would do 3 to 5 days a week. We would do 1 set of 10 to 15 repetitions, 8 to 10 different exercising, targeting all different muscle groups over the body. And doing that RP scale again, we would run a reading of 5 and 6. So on the right here, I just have a couple examples that you could do for Mr. Schofield, which are steps ups using a short step, squats with no weights, and calf raises. For his upper body, we would do shoulder press with dumbbells, bicep curls, and use elastic tubing when performing chest flexion exercises. So for flexibility and balance, we would do 2 to 4 days per week, 2 to 4 repetitions each stretch. Static stretching would be helpful. Yoga can be beneficial for older adults as well. And hold the stretch at a point of discomfort but not pain, so you will want an RPE rating of 5 or 6. So I just have a picture here of some beneficial yoga exercises that we could use for Mr. Schofield. And note that the chair is used to support his balance. I wouldn't really recommend this one here, or those ones might not be the best options. So in conclusion, we see that you should watch your heart rate, monitor yourself for any symptoms such as dizziness, fatigue, chest pain. If you have a pacemaker or ICD, make sure to give yourself proper healing time before beginning an exercise program, and meet with your doctor before starting an exercise prescription. I know that exercise is beneficial for everyone, and it is beneficial for people with pacemakers and ICDs because it can prevent cardiac arrest episodes. Okay, thank you guys for listening today. And lastly are the list of my citations. Thank you.